day, class. You are welcome to our fourth session. We are looking at the high-risk neonate, and today we are considering the HIV mother's baby and the alcoholic mother's baby. Session overview. Infants born to HIV mother and the alcoholic mother are classified as high risk related to maternal conditions. However, it is important to note that the alcoholic mother's baby is further categorized under drug-exposed infants. So don't be surprised when you find some books discussing the alcoholic mother's baby also under drug-exposed infants. The purpose for our presentation is to discuss the risk factors and their management. The purpose of our goals and objectives. You should be able at the end of this session to identify measures taken to prevent maternal, clinical, mother-to-child transmission of HIV, discuss the nutrition of the HIV mother's baby, and describe the features of the fetal alcohol syndrome, and describe the nursing management with fetal alcohol syndrome. The key topics we seek to cover is the infant of the HIV positive mother and the infant of the alcoholic mother. Once again, chapter 9 of our textbook will have this information available. And you could also review other articles online and add to your knowledge. The HIV mother's baby. We have to note that the newborn can be infected in utero or during delivery. Transmission can occur prenatal through the placental barrier or perinatal during delivery, and postnatal through breastfeeding when there are cracks on the mother's breast or the baby suffers some infections that brings about certain ulcers in the mother. However, majority of mothers also are given some treatment which also reduces their chances of transmitting the infection to their mother, to their newborns. And so in our part of the world, we encourage that mothers breastfeed, whereas in other advanced countries, they are not encouraged to breastfeed. So infants of the diabetic mother also has the risk of getting infected easily because the immunity is low because of the disposition of the infection from the mother, because the mother's CD4 count may be low and that may be transmitted to the newborn. When caring for such newborns, it's also very important that we wash our hands, and also the positive mother also requires frequent evaluation and monitoring of her CD4 count or virologic monitoring, and then immunization is also given to the newborn except for life attenuated vaccine, which is the polio vaccine. And also, I have said already that the transmission can occur during pregnancy, labor, delivery, and breastfeeding. So it's also very important that we note that the infection the mother can have it at the latent phase, which is the first symptom that the newborn may exhibit. And then mother can be also at the late stage where it will be advanced and will predispose the newborn to death. It's also very important to note that the CD4 counts or CD4 cells, which protects our immune system in the HIV mother, is destroyed and therefore is reduced. We'll look at what goes into it to make them positive. So some clinical manifestations that you see here are recurrent infections especially viral infections such as herpes simplex or zoster, what our people usually call anansi, or failure to thrive. The baby will not be growing as it should. Weight gain will be slow, and the baby will be wasting. The baby will have chronic diarrhea, and also it's also very important that we should know it will be difficult to assess this at the neonatal period. However, by the 18th month, the test can be done to ascertain whether it is positive or negative. Also, 3 virologic tests, the CD4 count for the baby born to the mother. When it ranges between 500 to 2,000 cells, then we should note that it is normal. It is also very important to note that we do the second test when the baby is between 1 to 2 months, the third test when the baby is 4 to 6 months, and the true results of the virologic test must be positive, that is less than 200, for us to say that the baby is infected. True negative test must be negative for us to say the baby is positive. So the first negative result must be from the second test, and then from the test confirm that. We have talked about some common conditions